come up here with me as well. Thank the President for putting together a package of bills that I think express the values of our Democratic caucus. And the assignment of benefit really, I would say, come down to three things. The first thing is that it's going to reduce wasteful administrative health care costs. The second thing is it's going to increase protections for patients. And the third thing is it's going to provide greater disclosure and information to patients. And what this is about is the classic battle with the insurance companies on the one side and the doctors and the patients on the other side. And although it's called assignment of benefit, really what it should be called is patient choice legislation, because that's really what it comes down to. Really what it boils down to is if you go to the doctor's office and you get care and it's not a network doctor, and the doctor says, will you assign the payment that you get from the insurance company to me so I get it directly, the patient might say sure, but under the contracts that the insurance company has with the employer, with the patient, that's prohibited. And so what happens is the patient goes home, they get a check later in the mail for the care that they received. Sometimes they don't know which doctor or who should I provide the check to. The doctor then has to have administrative time to call the patient, try to get the check. Did you get the check yet? That check belongs to me. It's an administrative inefficiency in the healthcare system. And what is done is to try to keep the thumb on the physicians from the carriers. About half the states in the country already have some form of this patient choice or assignment of benefit. We had the Attorney General, Consumer Protection Division, and the Maryland Insurance Administration say that this legislation is a positive step forward for patients. And earlier, during the 9-month interim, the Joint Committee on Healthcare Delivery and Financing had 3 meetings on it, unanimous support of the committee. This is something we're going to move forward through the Finance Committee and through the HGO Committee, and I'd like to have my good friend Senator Exum say a few words on this legislation as well.
Thank you very much. Good morning. Good morning. I'm delighted to be here to be co-sponsor of this particular piece of legislation because this is important to our citizens. As one who has been involved in this particular process several years ago, I went to have a procedure, and because it was out of network, the doctor asked me to sign a statement saying that the check should go to him. Lo and behold, the check did not go to the doctor. It came to me, and I'm wondering, what is this check for? What do I do with it? So I have to go all around the bond to make sure that the doctor got the check. I had to send the check back, and eventually they did send the check back, but through some interpretations of insisting that the check be sent to the doctor. So this will clear up that confusion between the doctor, the insurance company, and the citizen, so they won't be caught in the middle of this fight. So we're very hopeful and thank the Democratic caucus for supporting this bill. Thank you very much.
You've all heard the issue about the developmental disabilities waiting list. Senator Kramer and others have an idea in terms of how to assist with this waiting list.
Thank you, Mr. President. In Maryland, there are over 19,000 families who have family members, children and adults with developmental disabilities who are on a waiting list for services. Services like respite care, employment programs, and residential group homes. They are on a waiting list because there just isn't enough money in the budget to fully fund the needs of all of those families. I met a mother who's about my size, who is taking care of her 19-year-old developmentally disabled son. He's over 6 feet tall. She cares for him all day long. She does everything for him. She has to help him dress. She has to bathe him. And she has to keep him in the house because he likes to run out. And she physically has to grab a hold of him and try to hold him to keep him safe in the house. She does this day in and day out, night and day. She and her husband have never gone on a vacation in the last 19 years. They have not been able to go on vacation. This bill will put a checkoff on the Maryland state tax return, and it'll allow every Marylander the opportunity to check off the box and contribute $1, $5, whatever they like, to the waiting list to fund those programs for the families like the one that I just mentioned to you. And if this is successful, if we're successful in doing this, and if we're successful in letting the public know about this, then that family will have the opportunity for their son to have to know the independence of going out to a work program. And it'll allow mom and dad to finally have a very, very much needed vacation.
Thank you, Senator. The other issue, sex offenders issue, registration, information, expansion. Senator Grange.
You know, I don't think I have to remind anyone in this room the tragedy on the Eastern Shore on Christmas Eve with Sarah Foxwell. But we need to do something more to prevent this type of thing in the future. Prevent these predators from getting out there. You know, this individual was on registered in Maryland as a third-degree sex offender. But on Delaware, he was registered as a high-risk offender. No one searching Maryland's registry would have even known that there was anything connected in Delaware as a violent sexual predator. But what this bill will do will add to the registry and also look at surrounding states to include into Maryland's registry. Not only, and then going beyond that to hopefully statewide, so we know who these violent sexual offenders are. You know, Maryland's done a great job. The legislature's done a great job in addressing sexual predators and registry and things of that nature. But we certainly can do a lot more. One of the things this bill will do is bring us into the up to federal standards on the Adam Walsh Act. Instead of being registered on a biannually basis, it'll be done on a quarterly registration. Also, it would affect retroactive particularly for the worst offenders. That it would be a retroactive to the date of 1995. That making changes, without making these changes, Maryland could lose $2 million in federal funding. So it's something that we have to do. It's something that's needed to know who these people are and to prevent a tragedy that was recently experienced on the Eastern Shore. So this bill, I believe, will go a long way in preventing this type of thing in the future.
Many of our local elected officials do not have ethics laws applied to them. This is the local elected official Ethics Compliance Act. We have Senators Raskin and Senator Peters.
Thank you. I want to salute President Miller for hammering out this effective agenda and roadmap for us for this session. The essential condition for effective democracy is public trust. That public trust depends upon ethical conduct of office holders. We're proud that in Maryland we have some of the strongest state ethics laws in the entire country. But they don't apply all the way down at every level of government for county and local officials and school board members. This bill will require all local governments to enact conflict of interest laws and financial disclosure requirements for local elected officials and school board members that are at least as stringent and protective of the public interest as we have for the state. The bill also brings local government filing deadlines into line with our state deadlines and requires local governments to certify compliance with these provisions within 1 year of the State Ethics Commission. So we're very excited about keeping Maryland in the very forefront of developing the strongest ethical safeguards in the country for elected officials.